Imagine taking a sheet of paper, for example, and gluing wires or creating wires onto that sheet, that substrate, and then taking that substrate and wrapping it onto the medical device. That's what we would call an applique methodology. The issue, though, is that you now have to attach a foreign object onto the medical device. You have to make sure that it adheres, and you have to make sure that all of the edges that you create are streamlined. And you can imagine having the blunt edge of an applique on this tube going down the back of someone's throat and scraping tissue. You always have to worry about scraping and trauma to tissue when you use the applique methodology. One of the key attributes of micropenning is that when we apply an ink to the surface, it bonds to the surface and basically becomes one monolithic device. There are other engineering aspects to that bring an attractiveness as well. So for example, if you're doing an ablation process where you need to heat things up, applying the heater directly to the medical device as opposed to putting the heater on some sort of substrate and then putting that construct onto the medical device gives you heat transfer that's superior to the applique technique.